Hello and welcome to YHTV's Magical Medical Tour. This is episode 33. Hello, and I'm Christina Suzama on this incredibly glorious 90-degree fall day here in Los Angeles, California. And here with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman. Good day to you.
And good day to you, Christina, and welcome everyone to Magical Medical Tour. I'm Dr. Glenn Woolman, and I will be your guide this and each week, along with Christina, as we travel through the healthcare galaxy, searching for ways towards optimal health. So today, Christina, is a very special day, I think, in thinking about Magical Medical Tour. This whole process is sometimes related and focused on the magic of medicine. Mm-hmm. And I think we're going to have a magical show today. How are you doing?
I'm doing great because I'm so excited, Glenn. I mean, you know that we've been working towards this for a little while now, and we are like right on that edge, and it's so great to have today, may I say it?
Yes, please.
2 guests instead of 1 at the same time. So there's going to be 4 of us at this party.
Right. We are expanding. We are trying to do a lot of things to bring people not just information, but also different concepts at the same time. So this will open us up to having sometimes panels of people that might have controversial aspects or different viewpoints that they can actually discuss together. So this is very exciting in terms of the technology that we're incorporating into the show, always looking for ways to make it better. And in today's show, I think one of the things about medicine for me and making it better, as you know, is we all believe in this integrative or combinatorial approach to medicine. And today, we're going to have, when you hear the word family practice, what do you usually think of, Christina?
Oh, someone who's been in the business for a long time and in many generations.
Right. So the old-time doctors did sort of family practice, and now we have it as a specialty where it's the kind of the general practitioner. But this is different. This is a different type of family practice we have today. We have a brother and sister. Rupa Chari is an MD, and she is certified in internal medicine. And Deepak Chari, they both work at their Chari Health Center, and they do truly integrative medicine, and we're going to learn about that today. So, and they do it. It's a family affair. So this is a different type of family practice, and it's one of the true examples of people practicing integrative or combinatorial medicine. So I would like to introduce all of our global viewers to Dr. Rupa Chari and Deepak Chari. Welcome.
Welcome.
Thank you, Dr. Woolman and Christina, for having us on the show today.
Thank you so much for having us here.
Well, thank you for joining us. We're so honored and made me really, really excited because, again, this is the first time we're having all 4 of us together. And so you're breaking a record for us here at YHTV.
Oh, that's great.
Oh, like to be a part of that.
Yes. And also, of course, to be with you and to learn about the combinatorial medicine, which is a phrase that we use with Dr. Woolman here. It's exciting. It's exciting for our community to actually be able to hear from both of you at the same time. It's fantastic. Thank you so much.
Oh, thank you. It's a pleasure to be here.
Rupa and Deepak, what I like to do as the medical guide is to tell people a little bit of the path that we may end up taking today. Again, we can never totally predict, but I first want to start with a little bit of your stories about how, when, why you became healers and what brought you to that journey. Maybe talk a little bit about how you came together in the journey to develop your center. And then we'll get into some more specifics about types of treatment and technologies that you have incorporated, the different aspects of your healing systems, and we'll go on from there, and we'll see where that leads us. Does that sound all right with you?
Sounds fantastic.
Sounds great.
Great.
Okay, Rupa, I'd like to start with you, and I know that Deepak will come in at the appropriate time. But tell us what influenced you, and at what age did you decide to become a healer, and how did you go in the direction of eventually internal medicine and then into integrative medicine, or was it all part of the same path?
Absolutely. Well, my journey started off actually in childhood. And the inspiration really behind me, and Deepak will tell his story as well, but for me, for sure, for going into holistic medicine, integrative medicine, is because of our mother, Mrs. Manichari. Because when we were growing up, she would bring in healers from India who were just
Mm.
remarkable. And she had wonderful friends who really thought outside of the box. And when we were just in grade school, I remember even 6 or 7 years old, they would talk to us about mind body medicine, energy medicine,
Mm.
how the emotions impact our physical bodies, detoxification, and even many of the things we're doing right now with using green drinks and liquid minerals, and how, for how easily for the minerals to get absorbed by the cells, and, really simple nutrition, simple platform for healing, which is basically how our physical body, mind, emotions, thoughts, and especially stress impact our symptoms and physical disease and quality of life. So that was
Mm.
really the groundwork for what we're doing today. It was because, and when our mother would also make us homemade remedies, when we had the colds or cough, she would grind certain spices, and she cooked very holistically or Ayurvedically. Ayurveda is an ancient science from India, and her grandfather was an Ayurvedic physician and had a farm outside of their home where they would pick herbs. When
Mm.
the patients would come to their home, he would customize programs for their unique needs with fresh foods and herbs that were made at home. So that was that was passed down to my mother's mother and then to my mother, and she was passing that down to us. So, and my both of our parents did tremendous social work. We're always helping others. So we knew we would get in a profession where we would want to serve others and really do it in a holistic manner. And then when we were teenagers, I was around 15 at the time, and Deepak was 17. Our father had a massive heart attack when he was only 50, and he passed away. And it really caused us to ask, how did this happen? Why did this happen? And how can we prevent this from happening to others? And we realized, he was eating right and doing the right things and taking even the right medication, but it was stress related.
Mm.
He didn't want to upset us or make us worried. So he used to internalize all of his stresses. And that created inflammation in his body and ultimately, cost him his life. So we kind of, at that point, the three of us got together and said we wanted to create a new medical model where we would really take the time with people to see what was going on in their life, not just physically, but mentally, emotionally, and stress. And we really emphasize that as well, and take all factors into consideration, then to create customized programs for people.
Mm.
So then I went into medicine. And as soon as I was done with my residency, I said, okay, now is the time that I can also explore the other field I've been longing to do, which is natural healing and mind body medicine. And so that's how I got into really this field.
Mm.
Wow, you could see how all of those influences have influenced you.
Yes, literally.
Right. They're all early manifestations that have come out.
Mm.
Deepak,
Yes,
speak to us.
absolutely. Yeah. I was always on the journey of alternative healing, even at a very young age, even before that happened. And as my father, he had a PhD in chemical engineering, so I just thought, okay, I'm supposed to do that. So I just pursued that. I did my bachelor's degree and master of science degree in engineering. And during that time when that happened, of course, we were in high school, but I was always researching alternative ways of healing. That was always my core interest. So when that happened, when he passed on, then I began pursuing it even more stronger while I was studying my engineering degree and finishing that. And then I realized this is really where my passion is. But I was able to do the engineering as well and incorporate that into my psyche. All of my classmates were very left brained thinking in general, but I could do both very easily, and I think that helped a lot. So my sister and I were always kind of thinking together in the future, forming some kind of health center where we could actually help prevent this from happening to anyone else. But at the time, we didn't have the full technologies and techniques, though we had the concepts of how to do it. So that's when things just, when I started putting my attention there, that's when it was flowing in my direction. And all these, I started learning and discovering different mind body techniques and innovative things that were at the time were just recent at the time. You know, going into a store and finding a magazine with a tiny article that I just happened to open to, a magazine I'd never normally pick up. And I would just find a technique from here and find technique there, and then we'd pursue it and learn it from the original founders of that technology, fly to wherever they were, and master that. And we literally traveled all over the world to learn these techniques and technologies, and then incorporated that into what we do. And because of my engineering background, um, after we ended up forming our center, then I was also looking for technologies besides the mind body techniques. And as soon as I put my intention out there for that, I started through very unusual sets of coincidences meeting the right kinds of people who led me in turn to the original inventors and founders of these amazing technologies for mind body balancing, for stress reduction, for healing at the deepest level, and for intention and relaxation. So all of that started coming together the moment we put our mind out for this health center,
Hmm.
which became the Chari Center, actually.
Wow. Very nice. Rupa, when I look at some of the information from your center, you state that you are not a primary health care physician. So what are you?
Yes. Well, what we ask is that all of our clients have a primary care physician because I didn't take on any hospital affiliations. I'm strictly outpatient. So what we do is when they have their own primary healthcare physician, for their routine medications, refills, annual exams, and if there was any emergencies, they would have their primary care physician take care of that. But what we do, we consider ourselves consultants. So if they're seeing their primary care physician, let's say for high blood pressure, and they're on medication for that, then they come in to see us, and then I'll address all aspects of what may be contributing to that high blood pressure: their diet, their lifestyle, nutrition, emotional stressors, past traumas. It could be, and of course, stress, all of which contribute to that. So we address that with, nutrition, detoxification, certain clinically proven natural remedies, and then the technologies. So we consider ourselves really consultants to address the root cause of what their underlying symptoms or medical conditions are.
What do your patients consider you?
They would like me to be their primary care physician, but um, it's kind of, we really work in tandem with their doctors, because then I like to let their doctors know what I'm doing as well. I'm really trying to create a integrative model, not only within our own practice, but to reach out to other practitioners as well and medical doctors, and let them know what I'm doing to kind of give them that exposure as well.
Sure. And do you also work with other combinatorial or integrative healers like acupuncturists, chiropractors, naturopathic physicians, etc.?
Absolutely. Absolutely. Because we believe that we're all part of a mosaic. We have our piece in the puzzle of addressing what issues they have, but absolutely we work with other practitioners, chiropractors, naturopaths, acupuncturists, massage therapists, physical therapists, because when we're all working together, each has their own input and to bring out the best results.
Hmm. Yeah. When I look at regular medicine, for example, regular medicine, I don't even know what that means. Uh, allopathic medicine, say an orthopedic surgeon may be evaluating somebody's knee, and either they operate or they decide to send them to a physical therapist, either pre-surgery, post-surgery. then that orthopedic surgeon is working with the physical therapist, and the physical therapist usually follows the prescription of the doctor, but as a therapist, they also have their own understandings of things and they give feedback. How do you work with Deepak in terms of using what you know and then determining which technology or which equipment to use for each patient?
Yes. Well, when our patients come in, we have a pretty detailed intake form. It's about 21 or 22 pages where we go into every aspect of their life in detail. Physically, what nutrition, supplements they may be taking, how is their nutrition, their diet, their lifestyle, medications, emotional stressors, current stressors, past stressors, exercise, everything. I take everything into consideration as to what may be contributing to their symptoms. And then from there, we customize programs. For example, if they're having pain, we have remarkable pain relieving technologies. If it's related to stress, anxiety, and inflammation, we have other technologies that we'll direct them to. So, depending on what they need, then we customize their program. Then I'll speak to Deepak and we'll go over our patient's history, and he'll also, of course, give his input as to what he feels would be beneficial. And then from there, we customize programs for the technologies based on that.
Now, I want to get into some of the technologies, but before I do that, Deepak, when you have your meeting with Rupa, your consultation, and then you meet with the patient, and then you start working with them on their machines, and you see their results. Uh, what are the determining factors that tell you they're getting better, other than them saying "I feel better"? Are there any other things that you determine that you give feedback to Rupa to let her know that everything's working?
Well, it's also because we've been doing this for now going on 13 years, um, and those technologies came around 2002. Um, I've gotten good at actually sensing how the person is from the time they came before to the time they're leaving, and even how they're speaking and how they're reacting to the same situation that they came in for. So, so if they're feeling stressed when they came in, and many times they're unconscious of how stressed they are. Many times the clients, when they first come to our office, say, "Oh, I'm not stressed at all." I said, "Oh, okay, that's good. But are you anxious?" "Oh, yeah, I'm very anxious. I'm a little overwhelmed, in fact." I said, "Oh, okay, okay, yeah." So we have programs for that kind of thing, no problem. So I sense how they are before and how they are after to those same things that trigger them, and I can also see physiologically from before and after how the flushness of their faces, how their eyes are looking, how their face is looking, how their posture is, and how, because of the way they were holding the stress before they came in, totally unconscious of it. I can see all of those physiological changes, and it's very dramatic. And oftentimes the person is not even aware of how relaxed they are. They said, "I feel a lot better." But it's also the people they interact with that'll notice it right away. And that biofeedback aspect of it moves very quickly because the family members and all the people they affiliated with see the tremendous difference, and then they comment to others. So that's how I can tell, just by my awareness of their behavior, their manners, of their physiology, the way they're speaking, and the way they're reacting.
Hmm. Did you have a question, Christina,
Oh, I
or
just think,
many?
I mean, my brain gets so flooded. There's so many questions and so much to ask. I just love the fact that both of you are working on an individual together. I think
Yes.
that is how brilliant and how lucky for those individuals, that they can come in and actually speak to the both of you and sort of have such a tailor-made regimen that they would
Yes.
follow. And so the treatments that they would come in for, would they be coming in like on a weekly basis, on a daily basis, depending on what you're dealing with?
It depends. For some of the technologies, it may be weekly or some even maybe biweekly, depending on what their issues are. And then with the mind body techniques, what we have that quickly release stress, anxiety, depression as well, they may be coming in once a week for that or once every 2 weeks, depending on the how severe the issue is or how many underlying issues there are.
Mm. And those underlying issues, huh?
Yes. Always. It's like peeling an onion and getting to the core root cause of what may be really contributing to their issues
Yes, yes. Wow.
and symptoms.
And are most of the people that come to you, are they open to both techniques, for example? I mean, do their doctors recommend you to their patients, or do they just are find you from word of mouth and are able to come in?
Absolutely. Most people are coming in by word of mouth because they experience great results in their life and then they were telling their family and their friends. And most are very, very open to everything that we're doing. Some like have more physical concentration, meaning more of just of the diet and supplements and nutrition,
Mhm.
nutritional guidance from that point of view. Others are interested in both the nutrition and the mind body techniques that we teach them that they can use at home on a regular basis. But in general, most have been very open to all aspects: the nutrition, the supplements, the mind body techniques, and the technologies, because
Mhm.
that's really where we're moving towards in medicine.
Mm, mm. And so do you both integrate a lot of the Ayurvedic medicine that you were raised upon?
Absolutely. Absolutely. The principles of Ayurveda, meaning that's pretty much how we customize the programs for each person based on their unique body type, personality, you know, their unique composition. Then we kind of, and then of course, what stressors they have been going through, environmental stressors, their diet, their lifestyle. So we incorporate that. And then based on that, we will customize programs for them on a nutritional point of view based on that Ayurvedic principles, which are very powerful.
Mm-hmm.
It goes above and beyond the blood type.
Mm-hmm. Wow. That's exciting. I could live there.
Absolutely. Come on down.
A fun
Oh,
place to live.
yes. Yes. It seems like we need a lot more of your clinics all over the world, really.
Oh,
Oh,
thank
thank
you.
you.
Yes. My
That
goodness.
seems to be happening. You, Rupa, you work in thought field therapy.
But we became officially certified in many of the techniques then after a schooling. So, yes,
Hmm.
thought field therapy, neuro linguistic programming, hypnosis, and then I also was certified in interactive guided imagery. So, I use a combination of very powerful, clinically proven programs and techniques to get more, to expedite the process of healing and get quicker results.
You said you have many mind body techniques. I still want to learn a little more about the thought
Sure.
field therapy. Can you give us a definition of thought field therapy as a start or an example of it and how
Yes.
you might work with it?
Definitely. Well, thought field therapy was actually originally developed from a brilliant psychologist whose name is Dr. Roger Callahan, and he's in Indian Wells, California. He's now in his late 80s. He's a genius and a pioneer. He actually created this technique based on the principles of acupuncture and using some of the principles of neurolinguistic programming. But what happened was in the 70s, he was a clinical psychologist and he was working with depression, anxiety, but he always wanted to find quicker, easier, faster solutions for emotional conditions instead of coming back week after week. And he wanted to expedite that process and really get dramatic results. So he studied both kinesiology and acupuncture, but he wanted to use actually the principles of acupuncture and used acupressure. So really and quantum physics on top of that. So there's a technique that's based on tapping certain meridian points in certain sequences. And he developed algorithms or recipes for different conditions. Like for fear, he'll have certain sequence of positions that you tap. For depression, another. Phobias, another. Addictions, another. And he was also one of the pioneers of really introducing how food toxins can affect the energy flow in our body, which when that energy flow is disrupted, how that affects and impacts our emotional health and physical health. So this technique works very quickly. It's tapping certain meridian points in a certain sequence, And you can eliminate fears and phobias, anxiety, depression, oftentimes within minutes. And this
Mm.
is now being used all around the world where there may be natural disasters or wars. They're using these techniques have been taught to literally thousands of practitioners around the world and helping literally hundreds of thousands of people quickly relieve their anxiety, depression, fears, phobias within minutes. And this was one of the first techniques that we learned based on Deepak's research. And we've had dramatic results. And we've been using
Mm.
it now since 1996 to quickly help people overcome emotional issues that may be contributing to their physical symptoms. And indirectly, then the physical symptoms can be alleviated, and we can help people get off their medications because of that.
Mm.
Speaking of medications, many times when we give a medication, say for pain, it has a certain half-life. So then they have to take another medication at a certain point. Does this tapping recipe and instant relief of a fear or a phobia, is it lasting, or is it something that they can learn to do, and whenever they have the phobia, they can do a tapping on themselves? Is it something that is instantly gone forever, or does it just work in the time for that time?
Yes, well, for phobias, it can work almost literally instantly. In the majority of cases, I would say probably 85 to 90% of the cases, we can alleviate it within the first session or first couple of sessions. And if some more, if there were still some remnants, it's such an easy technique that we can teach them to use at home at any time when any fear would come up. They can immediately start doing the tapping in the sequence, and it clears it just within minutes.
Mm.
So, and oftentimes, if it's not cleared within the session itself, there may be, more core issues we need to deal with, and or there could be underlying toxins in their system, either like sensitivities to gluten or corn or dairy, that is actually creating a lot of inflammation in their system and is actually hampering how quickly the speed with which you can get results with this technique.
Mm.
Sounds great. I'm almost wishing you could show us all a little tap that we could use to
Sure,
clear something
absolutely.
up. Could you do that
Well,
right now?
It's up to you. If you'd like to, I can show you something now as well. Definitely.
Yeah. Do you need to? Can you do it on yourself?
Yes,
Okay,
absolutely.
great. Let's do it. Let's see how good our technology really is.
Excellent. So we can have your viewers think of, let's pick something a little easy. Let's say they have a craving for a certain type of food right now, let's say chocolate. And especially for women, this is really common. And so think on a scale
Before
of
you go
0 to
on,
10, and if there is some particular food you may be having a craving for right now, how intense that craving is. 10 being you really want to have that right now, or 0, not at all. And while you're thinking of that particular food or snack, whatever it may be, what you can do is tap the side of your hand. And this is kind of where you would do a karate chop, and tap that just for a few seconds. And then what you're going to do is tap under your eye, right on the bone, just 3 to 4 taps is good. And then under your arms, like halfway down your arms, in line with your armpit there. And then tap under your collarbone, just for with the 2 to 3 fingers, just a few times. And then you can just stop and think, okay, just see again on that scale of 0 to 10, how intense is that craving right now? Has it come down any? And if it hasn't, you can just repeat the sequence again, tapping the side of your hand, and then under your eyes, under your arms, and then under your collarbone. And again, keep tracking from, let's say it was an 8 before, has it come down maybe to a 6 or a 5? And you can just keep repeating the sequence. And if it doesn't go past, let's say, the number 5, or it gets stuck on a particular number, Dr. Callahan said that it's oftentimes due to an underlying toxicity to, it could be a food or a beverage, or there's some toxin in something you're eating or drinking that is actually aggravating and creating that inflammation and anxiety
Mm.
that's driving the behavior.
Hmm.
So, drink plenty of water. And really, we recommend most people to really cut down on the amount of wheat or gluten they eat, corn, and soy. These are three of the main culprits at this day and age because of many different reasons, one of being genetic engineering.
Mhm, mhm.
Mm. We, speaking about engineering, uh, Deepak, tell us about some of the technologies that you use. Give us an example of at least one of your favorite pieces of technology.
Okay. One of them is a Tesla-based neuromuscular electrical stimulation technology that is able to go to the source of where, for example, if someone is having severe pain, which is a common issue at our clinic, um, oftentimes they'll be taking some prescription drugs, which is fine, or some other lotions, which is okay, but the effect is temporary and the effect is still there and it's an underlying effect. But our technology is actually able to go to the source of where that pain is coming from and actually alleviate it at the source in a fairly short period of time. And these could be issues of pain or degeneration or atrophy or neuropathy that might have been there for 10, 20, 30, and we've seen a client with even 50 plus years. And yet, within a matter of weeks and perhaps months, just a few months, just a couple months, we can completely eliminate it and reverse it and go to the source of it, more importantly. That's what I'm very, very excited of because we've helped give people back their quality of life. And that's kind of the mission, underlying mission of the Chari Center, is to give people the quality of life back, get their life back to the way it was, or even better than it ever was. And so that's what I'm really, really excited about. We've actually prevented many knee replacement surgeries and reversed many range of motion issues, frozen shoulders, neck, severe neck degeneration and atrophy.
Mm.
And it's very exciting because these are people who actually had other things they wanted to do. They wanted to dance, hike, they wanted to become yoga instructors or do any kinds of other activities that they couldn't do before, and now they're able to do those things. So the quality of the life within themselves and with their family and friends is greatly enhanced.
Mm.
So
When
that's what I'm really excited about.
Yeah, that is exciting, especially when you start talking about quality of life, because that seems to be a very big issue. You know, people have their chronic problems and some can live with them, but the ones that can't, their quality of life goes down. It's nice to be able to offer within a healing process something that can return quality of life, maybe with minimal or at least less side effects. When
Yeah.
you you've mentioned a number of times now getting to the source or the deeper source or the root source. What is that for you?
Well, ultimately, what we've seen is that what ultimately is hindering healing or slowing the process down is ultimately going back to a lack of self love. And
Mm,
it seems too general sometimes. It seems like, how could that really be contributing? But ultimately, when we're hard on ourselves, beat ourselves up, there's shame, there's blame, guilt, resentment, regret, and we're holding ourselves responsible for things and experiences that we've had in our life. What we've seen, and when we've spoken to some of the leading authorities in many different fields related to healing, they've all concurred and said the same thing, that ultimately, when you really boil it down, it's a lack of self love. And what that ends up leading to is then beliefs, attitudes, behaviors that then can drive a person to certain direction, meaning certain foods they'll eat. It may be a pattern where they're harming themselves with certain addictions, with drugs, alcohol, food. It could be show up in many different areas of their life, but it's their beliefs, attitudes, perceptions, behaviors, from what they may have experienced during their life that has then caused them to have this deep lack of self worth, self love, that then drives them to certain behaviors where they're literally punishing themselves, harming themselves. And then that can then lead to them not taking care of themselves and then leading to then certain issues that we end up seeing as physical symptoms or disease.
That's a great answer. So now I need to know how the technology works on someone's self-love.
Well, in, interestingly enough, like the technology we're using for the Tesla-based neuromuscular electrical stimulation, when we're actually able to open up the areas that's the source of in this case, the person's pain or neuropathy or degeneration or atrophy, what we're actually finding on a deeper level is that those emotions that were lodged in those tissues that we're working on because are being released. In other words, we'll notice many times the client actually releasing those emotions while we're doing the session, and they're totally unaware of it. Even they may be going through several different emotions or in a certain series, and each follow-up session it might be different emotions or different layers of emotion. Even though we're actually working on the source of the pain, those emotions actually cannot just end up being released. And the person, it looks as if a big weight has been relieved off their chest, their back, their neck, their knees, or the area they had the issue. It literally is like they have a whole new lease on life.
Mm.
And it's something that I can easily see, and my sister can easily see, and they're often not aware of it, but they're smiling more. They look very relieved, and of course, and the test of it is when they go back to their families and friends, that just keeps the ripple effect going of that effect. So it's quite amazing in how that happens on the emotional plane.
Mm. Mm.
Do you ever see anyone that you feel you can't heal or help?
Oh, sure. That happens on occasion. And when it does, what we do is we have other tests that we use as well. Some we use right when they come in for the consultation, and some further down the road if we're not seeing any changes. And there's certain tests that we use called one is called the matrix assessment test that is non-invasive and that can really guide us along with looking at everything else we're seeing, what may be contributing, from a physical point of view, but even emotional and stress point of view towards their current symptoms. And then that guides us even more towards developing a program for them. And if that doesn't work, we always are reaching out to other practitioners as well, and we communicate with them with regarding the patient's situation and see how we can all work together to see what other pieces of the puzzle may needed to be added on to, or how we can all work together to bring about the best results for our patients.
Mm. Mm. What about individuals with quite serious cases of like fibromyalgia or MS? I mean, have those come across your path there?
Yes, definitely. Definitely with fibromyalgia, chronic fatigue. We've been working with that for many, many years. In fact, we were featured in a book where a woman wrote a book about top treatments for fibromyalgia. And
Mm.
because they experienced results with our techniques and technologies and program, they featured us. Because ultimately, when we're addressing the emotional root cause, we're addressing the physical biochemical imbalances, we're addressing the stress, kind of all in combination, versus fibromyalgia really is a constellation of symptoms due to many different reasons. And because we're kind of looking at all of those different areas of what may be contributing to that pain and lack of sleep and anxiety, depression, and all of the symptoms associated with fibromyalgia, we've had wonderful results with that.
Mm.
And toxins play a huge role in that as well.
Mhm. Mhm. Well, that's very encouraging for a lot of people out there because they're finding that it's sort of like rampant these days. So many people
Yes,
have come down with that, and of MS as well. And it seems to have hit a lot more females than males, unless that's sort of what I keep hearing. So, and
that's very true.
and would you say it's the same with MS patients as well?
Yeah, we honestly haven't seen many patients with multiple sclerosis. So, but from what I've heard from other practitioners, it's the same issues as well.
Hmm. Oh my goodness. So really coming down back to the core of a person's emotional state of being. That's what I'm hearing a lot from both of you, from you and Deepak. It has so much to do with the emotional core that you really help
Yes,
and work with the individual to find the balance within that.
Definitely, definitely,
Hmm.
because even fear, anger, and resentment, guilt, they can affect us physically just to the same degree that outside environmental toxins or diet and lack of exercise can do.
Hmm.
It can create the same physical issues as well.
Hmm. Hmm. And are the individuals that come in very open to the Ayurvedic medicines and the means of, do you work with herbs as well?
Yes, definitely. When we're customizing a program, we will use certain supplements, maybe certain herbs that can best help to balance them in all realms. Because the Ayurvedic herbs are also very powerful, not just from a physical point of view, but also for the adrenals and for balancing the emotions. It's very scientific, very powerful. So we kind of combine all of these together.
Mm. Mm. And what about things like meditation? Do you teach that as well to your clients, or do you have another person in your clinic that teaches that?
Yes, well, actually, Deepak teaches very powerful breathing techniques as well that are shown to be very beneficial.
Hmm. Hmm. So very similar to the pranayama techniques.
Yeah, I mean, they kind of date back a few thousand years ago, and it does incorporate that. Some of them are those kinds of pranayama techniques, and some come from keto and things like that. And but ultimately they help center the person. And in addition to that, I've also made my own CDs where I've layered music and created special frequencies and entrainment such that it'll actually take the person down from a regular conscious state even up to a theta state.
Mm.
And I've also put wonderful affirmations into those CDs, which the person won't even need to listen, or they're hidden in there. They're silent, and it goes right into their subconscious. So even if there's subconscious resistances to even the healing or to the change, these CDs, that's where these come in.
Oh, magnificent. Okay, I'm ready.
I have a question about your Ayurvedic medicines. For example, there was uh, my understanding was that in our country we stopped allowing certain herbs that came in from India to come into this country because of contaminants in them. So when you use your uh, medications or your Ayurvedic herbs, where do you get them from?
Hmm. Well, we get our herbs actually from the States. They're wild crafted, organic, and grown in the US. And the certain ones that we use that may be from outside of the US come from companies that are very pristine and have the highest quality, in fact, in terms of the way the herbs are grown and processed. So, but really, I would say 99% of the herbs that we use are from the States. But based on the principles of Ayurveda, meaning cooling herbs or heating herbs that are grown right here locally.
Mm.
When you uh, when you work with people, there are many times that people now are getting on the internet and looking up their own body type and figuring themselves out, and they go to certain stores and they can find certain supplements and medications. Uh, how do you feel about people doing that on their own without really being analyzed by someone professionally?
I think it depends for certain, but like vitamin C and very common, like a multivitamin, things like that. That's great. But really speaking, for more customized herbs, and especially if they're on medication, it's always better to seek healthcare practitioners who are well versed in both traditional allopathic medicine and herbal medicine so that they'll be aware of any drug interactions, between the medication they're on, the herbs, and can really more fine tune a program based on their unique needs.
Hmm. when when people come into you with medications and you try and either decrease their dose or get them off these medications, sometimes you're replacing them with more natural herbs or medicines. Is that correct?
Yes, yes, absolutely.
And when
And
you
I'm
do that,
always in communication with their primary care physicians as well to let them know what I'm doing so that they're aware of that
So when they are starting to take your medications, do they usually take them for periods of time, or is it that they possibly may be on it for a lifetime? For example, even a supplement like a vitamin C, we don't usually take that for a week at a time. We usually take that for our lifetime. So if these medications, some of them are given to people where they are going to continue to take them for a lifetime, what is it that you see about the herbs versus the Western medications that make them better for that purpose?
Yes. Well, there's certain, I would say, food supplements that I would have them take on a daily basis, really for the rest of their life. And there may be some herbs as well. And some of the benefits are then you don't have to worry about many of the side effects that could be present with some of the regular pharmaceutical drugs. I mean, definitely pharmaceutical medication has its place. There's no question about that. But my goal is if we're able to decrease how much they're taking, and even in many cases, I'm able to get them off the medication and supplement that with the herbs so that they're not going to have the side effects they would have had with the pharmaceutical drugs. Or if they're on a less dose of the medication, they won't have as much of them. And their quality of life is enhanced. Energy levels are enhanced. They won't have as many of the digestive issues because ultimately, when we also address the root cause of some of their underlying physical issues, which are related, adrenal related, stress related, we can address that with certain herbs, certain nutritional supplements, and definitely a nutritional program so we can alleviate some of these side effects and ultimately, they have a wonderful quality of life.
Yeah, excellent. We like that. We talked earlier about some of the things that you do, and we brought up the concept of neuro-linguistic programming. Would you go over that for a moment? I know a lot of people have heard of that, but maybe some don't know what that actually means and how it presents itself in terms of diagnosis and healing.
Definitely. Well, and Deepak will be able to expand on this part, but because he's the one actually that did the research, and we studied from one of the co-founders of neurolinguistic programming, Dr. Richard Bandler, because he's one of really a pioneer and genius of our times to really help people. Because the brain, if you think about it, is like a computer, and there's certain programs that we run on, programs then that create fear and anxiety, depression. And Dr. Bandler found different ways that with our visual, with our vision, our auditory senses, with our feelings, that access different parts of our brain. And by changing the way we see an event, making the picture smaller, changing the color of it, the intensity, the sounds, the brightness, depending on, let's say, how a person saw a particular traumatic event in their life, by just simply changing the picture of it so they can step out of the picture, see the event occurring, but they're not in the picture, changing the colors and brightness of it, the sounds, make them maybe add funny music to it while you're seeing it. It actually changes the way we perceive and interpret that event, which then decreases how much stress they feel. They feel lighter about the situation. They don't feel like they're right in it. And you can use these really powerful techniques for many different things, whether it's building self confidence, depression, anxiety, and because he really saw the brain as a computer program and then how to shift how we interpret events based on that.
Hardware and software?
Yes, literally.
Yeah. He actually, Richard Bandler, the co-founder of neurolinguistic programming, was actually a computer programmer. And that's why when he was observing people's behavior when they had a traumatic incident or how they reacted to an emotional situation, he literally was trying to decode their hard drive, defrag their hard drive, and reformat their hard drive using language patterns or linguistics. And the linguistics were the actual computer code of their subconscious mind. So by changing the way you change the wording and the linguistics, you can literally reprogram their mind and change how they view the world and how they react to the world.
Brilliant.
Where do you see the future of medicine?
I think honestly, it's the way, Dr. Woolman, that we are all practicing it right now. an integrative approach, using the best of traditional medication, wherever it's required, but really going back to, again, looking at the root causes, seeing a person as a whole, holistic approach, looking at their diet, their lifestyle, exercise, nutrition, and seeing what emotional factors may be contributing mentally, emotionally, stressors in their life currently, stressors in the past, emotional traumas, looking at their childhood, and seeing everything as part of the whole of what's leading to what they're experiencing today, and preventative medicine, and then combining the best of nutrition, natural remedies, a traditional allopathy and pharmaceutical medication if it's required, mind body medicine with the incredible techniques that we're learning and the new ones that keep coming up, and then these revolutionary technologies
Mm,
that are non invasive, safe, and expedite the healing process.
mm.
Speaking of revolutionary technologies, Deepak, we used to watch Star Trek and we would see Dr. McCoy just run a scanner over someone and figure things out. Do you think we're going to get that technology?
Absolutely. I think the technology may already be here. It's just a matter of us being aware, getting into our field. So I think it's all there, and I think we're moving quickly in that direction. I mean, we're in an amazing time right now, and
Mhm.
I think all the technology is coming very quickly because that's how it's going to raise the consciousness of our planet as we're all clearer and clearer. So
Mhm.
absolutely, yes.
Mm. I'm very excited. I have a question with the patients that you see. Do you have any children?
No, we basically see patients who are 18 years of age on up.
Hmm. Hmm. I mean, is there a reason for that? That you've chosen that sort of guideline?
Yes, absolutely. Because I'm board certified in internal medicine, so my training is from basically 18 years of age on up. But if there are children with any needs, then we always, and definitely when our clients have children, we always refer them to other practitioners in the area who work with children.
Hmm. Hmm. That's interesting because I'm thinking of the integration, especially with what Deepak also does with all the science and raising and shifting energies. That some of the children, how they might be able to fare really well with it because they're just so open still at that stage without a lot of the emotional ties, unless it's past life, of course.
Mhm.
um, that in order like to clear them would be actually
Yes.
and rebalance them would actually be a lot faster.
Definitely, definitely. We're hoping to be able to introduce these techniques to parents with and their children
Hmm.
all together actually. So because children take to this so quickly, they love it, they understand it, they're so open. Sometimes we've taught this to some at some schools,
Oh,
and it's
great.
just a joy to watch. And we want to teach the teachers so they can teach it to their students. That's ultimately another one of our goals.
Right, right. Especially those tapping techniques, before they go
Yes,
in for a test or something.
absolutely.
Yeah. It's
It's a
wonderful.
great idea when somebody goes in for an MRI and they're always claustrophobic. That would
Yes,
be
that's
very good.
me.
So with each of our guests, we always ask for a special health tip, something from your own journey that you have discovered that you might want to share with others. And because this is a special day, uh, normally we get one health tip, but I think we're going to want something from each of you, from each of your points of view. So why don't we start with you, Deepak? You have a health tip for us?
Yeah, I have like an Aikido technique that probably all your viewers might benefit from. Um, so basically, what it is for your viewers to think of something that creates some kind of emotional overwhelm or stress, and rank it on a scale from 1 to 10. 10 is the most stressful, and 1 is the least stressful. So pick something that's stressful and rank it. So let's say you think of something and it stresses you. It's on an 8 or something. Then then what I'd like them to do is then to turn all their attention into their stomach. In in other words, imagine that their brain is in their stomach, literally, and they actually visualize. and then see what happens to that stressor that they, let's say, labeled as an 8, for instance, and keep doing that. And what they'll observe is that it'll actually start dropping from an 8 to a 7 to a 6 to a 5 or even less. And then what they can do is then switch gears and then think of something that totally makes them full of joy and full of absolutely something they love to do and that they feel at a 10 at. Just think of that. And then while they're thinking of that, then switch back all their attention back to their stomach, where they're thinking from their stomach only, and think of something that causes them, that where they feel stressed about. And then what they'll notice is that those wonderful happy feelings they're feeling, and then those stressful feelings will almost match. The stressful feelings will drop down in number, and as they head to 0, and then those happy feelings will be at 10. So then they'll be actually able to function in any kind of stressful environment, even with anything that comes up.
Mm.
And when they physically test the person, let's say they're thinking of a stressful thought and they're on a level of an 8. If someone was to push them in the beginning when they're thinking of the stressful thought, they could literally knock them over. So, and when they turn their attention and imagine that their thoughts, that the word they're thinking is coming from their stomach, and they think of that same stressful situation, when they're again pushed from the center of their body, they will not be able, you cannot budge them at all. They will literally be like a tree. And this technique is known as keep 1 point in Aikido. And literally, their center of gravity is restored. So this actually affects the person not only on a psychological level, but on a physiological level, where they actually are stronger, and even people viewing them will actually feel they actually take on a stronger persona. And if the person's easily intimidated, they won't be anymore, and the person that used to intimidate them won't feel the need to even do that. So it'll change the whole dynamic overall. So this is a very excellent technique.
Mm.
It is an excellent technique. I was going to say that someone gave us that exact health tip last week.
Oh,
But
is that right?
but
Okay.
no one has ever given us that health tip. It was very good. What did you call it in Aikido again? The 1 point?
Keep 1 point.
Keep 1 point. That in itself is a great health tip. Keep 1 point. I like that very much. Thank you.
Sure.
And Rupa.
Yes, well, a great health tip that actually changed our lives way back in the early 90s was, before we were feeling exhausted and stressed, and, at that time we were just getting out of school, so we weren't eating the healthiest either. And so what we started doing was drinking superfoods. And superfoods are something that any one of your viewers can get from their local health food stores. And that can be something that has spirulina, chlorella, blue-green algae, and it has other greens as well, usually these mixes. It's a powder. And in a blender, you just add some water. And then from our farmers markets, we get organic, unfiltered apple juice. And we mix about a scoop or 1 or 2 tablespoons of the powder in there with some organic bananas and sprouted seeds. We use sunflower seeds and pumpkin seeds that are raw, they're not salted or roasted. And what you do is you take those seeds and you soak them in a bowl of water, or or you can use a special sprouting plastic device if you like, or just put maybe 2 tablespoons of each the sunflower seeds and pumpkin seeds in a bowl of water, soak it overnight, about 12 hours. 12 is the magic number for the sprouting to start. And the next morning, you just rinse those seeds and you add 1 or 2 tablespoons of those seeds to 8 ounces of water, maybe anywhere from 2 to 6 ounces of ideally unfiltered organic apple juice, 1 or 2 tablespoons of this green powder that you can get from the health food store. And you can add any of the fruits you like. Sometimes we add blueberries. And you blend that up and drink that first thing in the morning. And we also drink it mid-afternoon. When you get that mid-afternoon slump, when you get a little bit tired again, we have another glass of that. And our energy levels are outstanding. And because it's liquid nutrition, goes very easily from your digestive system right into your bloodstream, into your cells. Your cells lap it up, and you feel that boost of natural energy from great sources.
Mm,
And we drink that every day.
wow.
That's a great tip. Now
Mhm.
I have a question, because when we originally introduced you, we said this was a family affair, and I know that your mother works with you at the
Yes.
center. I was there the other day, and she offered me a very wonderful green drink. Was that the drink that I was the beneficiary of?
Yes,
Absolutely.
absolutely. Her special recipe on that drink.
Mom's special recipe.
Her mom's
She makes
special
it for us
recipe.
every morning,
Yeah.
and for our clients as well.
Well, you see, I'll be there.
We'd love to have you over.
Oh my.
I like the fact that you gave a recipe, because I
Yes.
think that people will want to have to watch this show over and over again to get that recipe and make sure it's pretty clear. Before we leave, I want to give you an opportunity to speak about anything that we might not have spoken about yet, and that you would like to offer to our viewers. Is there anything that we haven't covered that you think should be covered?
For me personally, what I wanted to mention was a leading edge test. Really, it's not a diagnostic test, but a tool, I should say, a leading edge tool that's non invasive using only urine and saliva that is remarkable. It's a test originally developed by NASA. And then another brilliant doctor, Dr. Richard DeCenso, took the information from that and created this test or tool that can be used with absolutely be used with other conventional tests. We use this in conjunction with that. And at this point, I'm one of the few medical doctors in the country that uses it because Deepak is always researching the most leading edge tools and techniques, technologies that we can use at our center. And this particular tool helps to really assess what is going on in part of the matrix, meaning not just from a physical, biochemical point of view, but to see their patterns, their tendencies of genetics, even of like hydration, detoxification, digestion, their adrenal function, mitochondria, which is the energy producing parts of our cells, and see overall what is happening at a physical level that's contributing to their physical symptoms. It's a remarkable test. We've all done it, my family, my brother, myself, and my mother ourselves. And we've offered it to our patients for the past year. And it's really helped us to customize a program based on our clients' unique needs and using that along with conventional lab testing and of course the intake when they come in for their consultation. So that's a leading edge tool that we found that has really enabled us to really better help our patients as well.
Well, thank you for that. I appreciate
Sure.
that. Uh, I'm very grateful to our guests, Dr. Rupachari and Deepak Chari, for sharing their wisdom and knowledge with us and their journeys today. Uh, you'll be able to connect with them through our website after the show. I would also like to honor my healers and all of my teachers as they help me along my journey. And I just wish all of you, as we travel next week into another galaxy of healthcare and the Magical Medical Tour, all of you should have optimal health. Many blessings. Thank you, Deepak, and thank you, Rupa.
Thank
you,
you.
Glenn.
Thank you, Dr. Woman, and thank you, Christina.
Thank you
We are
Thank you,
so honored to
Christina.
be on your show today.
Oh, and we are so honored to have you both. And I hope to have you both again in the near future. I think there's a lot more that we need to learn from both of you. Thank you so much.
Thank
Thank
you.
you. We look forward to that.
And of course, we invite each and every one of you to join us every Tuesday for the Magical Medical Tour at this time at 10:30 a.m. Pacific Standard Time, 1:30 Eastern Time. And of course, on Wednesdays for Trinity of Life, which is at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Time. You can also find Dr. Glenn Woolman at myyogahub.com/G Woolman or on Twitter at Glenn Woolman, one word. and of course through his own website, glennwoolman.com. And if you go there, be sure to learn about his Metaphor Square Breath. And now you have also that and many other articles and links that he's continuing to compile onto his site. And until the next time, we look forward to having you with us again. Namaste.